Hello and welcome to KLM Institute.
Have you ever found yourself sitting in a room, feeling perfectly fine, when suddenly, out of nowhere, you detect a strange, sometimes unpleasant smell? It could be something like burnt toast, rotten food, or even something more unusual that you can't quite place. The most puzzling part, no one else in the room can smell it. You're not alone if this has happened to you. What you might have experienced is a condition called phantosmia, also known as olfactory hallucinations. It's when your brain tricks your nose into detecting smells that don't actually exist. In today's video, we're going to explore what phantosmia is, what causes it, how it impacts daily life, and how you can manage it. So if you've ever wondered about those strange, phantom smells, stick around. What is phantosmia? Imagine you're sitting comfortably in your living room after a long day. You're enjoying some quiet time when suddenly, you detect an overwhelming, unpleasant smell. It's not a familiar scent, but rather something harsh and unpleasant, maybe burnt wood, sewage, or even a rotting smell. But here's the kicker. No one else around you can smell it. This is what we call phantosmia, also known as olfactory hallucinations. So, what is it exactly? Simply put, phantosmia is when you smell something that isn't really there. While some people report pleasant phantom smells, the most common experiences are of strange, foul odors. The smell can appear suddenly and may come and go. It might even be stronger on one side of your nose, or affect both nostrils. Imagine living with these unexpected smells. It can be a confusing and distressing experience, especially when you can't explain what's happening. But you're not alone. Phantosmia is more common than you might think. What causes phantosmia? So, what causes phantosmia? Unfortunately, there's no single answer. The condition can be triggered by a variety of factors, many of which are linked to the brain, sinuses, or even infections. Let's dive into some of the most common causes of phantosmia. 1. Head injuries. A blow to the head can affect the brain's olfactory system. This can lead to phantosmia, as the brain might misinterpret or incorrectly process scents. 2. Upper respiratory infections. Cold viruses or sinus infections can inflame the nasal passages, disrupting the normal function of your olfactory system. This can sometimes lead to phantom smells, especially if the infection affects your sense of smell. 3. Seizures in the temporal lobe. The part of your brain responsible for processing smells is the temporal lobe. If there's an issue here, it could cause phantosmia. People with certain types of epilepsy or seizures might experience this. 4. Sinus infections. Sinus problems, whether due to allergies or an active infection, can also affect your nose's ability to detect real smells, leading to phantom ones. 5. Parkinson's disease. Parkinson's can alter the sense of smell, and some people with this neurological condition report experiencing phantom odors. 6. COVID-19. A lot of people have heard about COVID-19's impact on the sense of smell, and recent studies have revealed a connection between the virus and phantosmia. While many patients lose their sense of smell, some also experience lingering phantom smells even after they've recovered. If you're noticing phantom smells, it's a good idea to consult a healthcare professional. They may run tests to determine if there's an underlying issue, such as a brain tumor or another smell disorder called parosmia. Parosmia is a condition where real smells are distorted into something unpleasant. Phantosmia and COVID-19. Speaking of COVID-19, recent research has shed light on how the virus may be linked to phantosmia. Many COVID-19 patients report a loss of smell, but interestingly, some have also experienced lingering phantom smells, such as the scent of burnt toast or even rotting food, long after their recovery. Studies show that around 6% of COVID-19 patients have reported these types of olfactory hallucinations. Why does this happen? The virus might be affecting the olfactory system, causing disruptions in the brain's ability to interpret smells. Though the exact cause is still being studied, it's clear that COVID-19 has brought more attention to the phenomenon of phantosmia.
Parosmia, which means, an abnormal sense of smell. Dysosmia means sort of bad, sense of smell in terms of smelling something foul. Some people can say, yeah, nobody smokes cigarettes in a house, but I smell smoke, and I can't find out where it's coming from. Or, something like a coffee can smell kind of sour.
How does phantosmia affect daily life? Imagine your everyday life, from enjoying a meal to going about your work, suddenly being overshadowed by an odor that no one else can detect. Our sense of smell plays an essential role in how we experience the world around us. Pleasant smells can lift our mood and trigger happy memories, but for someone with phantosmia, the constant presence of foul smells can be deeply disruptive. People living with phantosmia often experience depression. Continuously smelling unpleasant odors can take a toll on mental health, leading to feelings of frustration, isolation, and sadness. Loss of appetite. The constant presence of bad smells can make food unappealing, leading to a loss of appetite and potential weight loss. Weight loss. If phantom smells make eating difficult, you may not get the nutrition your body needs, which can result in unintended weight loss. Safety risks. Phantosmia can make it challenging to distinguish real smells from phantom ones. For example, you might think you smell smoke, which could lead to unnecessary panic or missed warnings of actual dangers, like a gas leak. For people working in careers that depend on a strong sense of smell, such as chefs, firefighters, or perfumers, phantosmia can be especially challenging. It can make it difficult, or even impossible, to do their jobs effectively. Treatment options for phantosmia. The good news is that phantosmia can be treated. Treatment often involves addressing the underlying cause, and there are various methods available to manage the condition. 1. Conventional medicine, allopathic treatment. If an infection or neurological issue is responsible for phantosmia, medications like antibiotics or anti-inflammatory drugs can help. In some cases, surgery may be necessary to correct nasal damage or blockages. 2. Homeopathic treatments. Some people turn to homeopathy for relief from phantosmia. Remedies like natrum muriaticum, sulfur, and phosphorus are often used. However, it's important to consult with a professional homeopath or doctor before trying these treatments. 3. Ayurvedic remedies. Ayurveda emphasizes balancing the body's elements. Herbs like ashwagandha, brahmi, and turmeric can support neurological health and help the olfactory system function better. Nasal treatments like sesame oil and neti pots are used for sinus-related causes. 4. Natural remedies. If sinus problems are causing your phantosmia, remedies like steam inhalation with eucalyptus or peppermint oil can help clear congestion. Herbal teas such as ginger or peppermint can also reduce inflammation and promote healing. 5. Mind-body approaches. Stress and anxiety can worsen phantosmia, so techniques like deep breathing, meditation, and yoga can help calm the mind and reduce symptoms. The sensory loop. A strange phenomenon. Have you ever eaten something, like a piece of cake or a mango, and then suddenly smelled it again, even though it's no longer around? This happens because your brain is reinforcing sensory memories. Your mind can sometimes remember the smell, causing your sensory system to react as if the scent is still present, even though the actual smell is long gone. This sensory loop can sometimes make phantosmia more confusing, as your brain locks in on a scent that doesn't exist. Coping with phantosmia. Living with phantosmia can be tough, but it's possible to manage with the right treatment and coping strategies. It's crucial to speak with a healthcare professional to understand the underlying cause of your symptoms and find a treatment plan that works for you. Whether through conventional medicine, natural remedies, or mind-body techniques, there are ways to regain control and improve your quality of life. Insights from homeopathy experts. We spoke with a few homeopathic doctors who shared their experiences with treating Phantosmia. According to Dr. Cotton and Dr. Mazzari, while cases of Phantosmia are rare, they've seen success in treating patients using homeopathic remedies like sulfur and others. Early treatment can lead to positive outcomes, but delays may lead to more complex issues. Phantosmia, or olfactory hallucinations, is a mysterious condition that can be caused by various factors, such as head injuries, infections, or neurological conditions like Parkinson's disease. While it can be unsettling and confusing, the good news is that there are treatment options available. Whether through conventional medicine, homeopathy, or stress-reducing techniques, it's possible to manage symptoms and improve your quality of life. If you think you're experiencing Phantosmia, make sure to consult a healthcare professional for guidance. You're not alone. There's help available. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and share it with others who might benefit from this information. Take care of your health, and stay tuned for more informative content from KLM Institute.